Symptoms of varicose veins include swelling of the legs, a throbbing sensation, restless leg syndrome. Perhaps 80% of restless leg syndrome patients are taking drugs for no reason. What they really need is treatment directed towards the venous insufficiency that causes swelling in their legs. Patients' legs are more fatigued than they should be. They feel heavy and aching at night. There's cramping, difficulty walking, itching and burning of the skin, skin discolorations, and chronic insufficiency can cause even more serious complications, including eczema, inflammation of the tissues, actual ulcers, deep vein clots, pulmonary emboli, and bleeding. One reason to treat varicosities is not only to improve the comfort of the legs and the cosmetic appearance of the legs, but also to limit superficial thrombophlebitis, which in itself is not dangerous. It's quite painful when superficial veins become clotted, hard to touch, hot, but this will resolve on its own in a few weeks. However, people with superficial thrombophlebitis have an increased incidence of deep vein thrombosis, the kinds of clots that can become pulmonary emboli that can progress up to your heart and through the heart into the lungs. We have many male patients who deny fatigue and heaviness. They say, well, it's just my bulging varicose veins. My 5-year-old pokes at them. I'm embarrassed to go to the beach. And they call up the next week and say, Doc, it's a miracle. My legs feel so much better. And oftentimes I find myself saying, Fred or Bill or whoever, I'm looking at your chart and you said that you had no pain. And I documented that it was for cosmetic reasons only. You know, Doc, I guess I just didn't realize how uncomfortable my legs were. I thought that was normal aging. Causes of varicose veins include genetics. Certainly if your mother or father had varicose veins, you have a much greater risk. Pregnancies. The veins are dilated because the uterus is pressing on the venous return. The valves become separated and many times no longer function. Many of our patients date their varicose vein problems from their first, second, third pregnancy. Obesity has long been thought to be a cause of varicose veins and venous insufficiency, but we don't see that so much. Many thin runners have terrible varicose veins. We have professional hockey and soccer players, people extremely fit, not obese at all. It seems to be that it's the miles, not the years, or obesity that contributes to varicosities and to valve failure. Occupations that require standing a great deal, standing for long periods of time, seem to promote the development of venous insufficiency. It's easiest to understand venous insufficiency if you imagine a tree, an upside down tree, with the trunk being the saphenous veins, these veins that I mentioned that run about an inch below the surface and drain the superficial aspects of one's leg. A tree made out of rubber tubes, a big trunk, downwards larger branches, if swollen become varicosities, smaller vessels, smaller branches that would become reticular veins, and twigs that are spider veins. If the valves aren't continuing to let venous blood flow one way to the heart, if they're not supporting that column of blood every 6 inches or so, then everything downwards from that incompetent vein distends, has increased flow, and the skin suffers from all that pressure. The saphenous veins run in the leg from the groin area all the way down to the medial ankle, and from the back of the knee down the posterior calf. There's a greater saphenous vein and the lesser or small saphenous vein. This is a picture of the valves. They're small flaps. They occur about every 6 inches. They open as the blood flows upwards towards the heart, and they close as the blood begins to return. If they're incompetent and not working, the blood flows right back down the legs. Your calf muscles squeeze the blood. The muscles in your legs squeeze the blood has to go upwards. When your muscles relax, those valves should stop the blood from flowing back down. If they're failing, the blood flows back down the leg, and all the pressure of that column of blood is transmitted to everything below. So, what goes wrong? Damaged valves cause flow down the veins and increased pressure. This leads to dilated veins, varicosities, reticular and spider veins, and damaged microcirculation, with leakage of fibrin and blood cells causing the changes of stasis dermatitis, eczema, ulcers, hyperpigmentation, swelling, and lipodermatosclerosis.